Hey, manual therapy friends, this is Dr. David from El Paso Manual Physical Therapy, and I've got this research review Monday for you. It's out of the Journal of Manual and Manipulative Therapy. The research title is Management of Lumbar Spinal Stenosis Through the Use of Translatoric Manipulation and Lumbar Flexion Exercises, a case series. Now, this was published in 2013, so it's not too old. It's just 7 years old. And I thought this was pretty cool because you don't see many research articles that are specifically for lumbar spinal stenosis. You see about lumbar back pain, lower back pain, lumbago, but not spinal stenosis. And this was a case series, which just means that they looked at 6 patients and took a bunch of data points off of those. So they didn't officially call it a case study, they call it a case series. But I love how they did it. This was a cool research article. They went into detail about the techniques that they did, and they're pretty much manipulating their spines and getting some pretty good effects. So one thing to note here in the abstract is that surgical intervention is commonly performed to relieve the symptoms. They're cleaning out the foramen on if it's lateral stenosis, or the inside of the spine, or doing like a laminectomy to relieve pressure on the stenosis sites in the spine. So some highlights here. What they looked at, they compared. They talked about what conservative treatment options are, basically what the other options are for patients besides surgery, and it's pretty much just drugs. Here in the yellow section, I have that they use a combination of non-steroidal anti-inflammatory medication, general physical therapy, so conditioning exercises based on lumbar flexion, abdominal strengthening, pelvic traction, lumbar corsetry, aquatic exercises, and partially unloaded treadmill ambulation, which are all good, but none of that addresses the mobility in the spine. That's why manual therapy needs to be a part of their treatment plan. What this study showed, what they showed here in these studies about the conservative care is that generally patients do good with that kind of care. They don't decline if they keep up exercise and treat it conservatively using these conservative options. So that's good evidence that we don't need to go to surgery right away. But how can we make it better? How can we get even better? That's the big question that this study is after. So here they just used all the clinical tests and measures and all the way that they diagnosed lumbar stenosis. They did a good job. These are definitely stenotic patients. So I'm going to kind of skip through that. And let's get to the techniques that they used. So they did low amplitude or low thrust maneuvers and high thrust maneuvers. So basically like a mobilization and a manipulation. And you can see here on this picture on the left, that rotates it. Let's zoom in. They were pretty much mobilizing the upper thoracic spine and all the way down to T9 is what they wrote, using this wedge thing that I've never heard of. The therapist would lean into it and just kind of sustain some pressure, and then they would do some thrusts. And they even talked about how the therapist had to move their head and thrust. I thought that was pretty interesting. But they freed up motion in the thoracic spine. And then over in this picture next door, they did a side bending manipulation. So they locked out the patient. It looks like her leg is bent, kind of in a lumbar gapping position. But she's not fully rotated over here. I thought that was interesting. But the therapist is pressing into side bending in a manipulative manner. So potentially they're getting joint cavitations here, but they're freeing up stiff joints is pretty much what it is. And if you think about it, if you think of lateral stenosis or central stenosis, the holes, the stenosis has to do with 2 bones changing their position. Occasionally you get bone spurs and other things that can grow into the holes. And so that can be a factor, but assuming that you don't have good mobility in the spine, those joints can get locked in such a way where it pinches a nerve. So I love that they studied this and found some good results. Now across the board, they did exercise as well. This is what this is showing here. So this is a resisted abdominal exercise for lumbar flexion. As part of the home exercise, they just tied up a band up high to a door or something and did like ab curls, sit up type motions. But across the board, here's the stats that they gave, just the ages of everybody, their medical diagnosis and pain distribution, functional deficits, and then here's all the outcome measures. And what you got to look at here is here's the MPQ, the McGill Pain Questionnaire, and the Oswestry Disability Index, and then right below it is at discharge. This is at initial and at discharge, and across the board their scores improved, so they all got better. So it was beneficial. So I loved it. I thought this was great evidence that manual therapy can definitely help out a lumbar stenosis patient. I've worked with therapists in the past. I've been around therapists that are kind of afraid to deal with a stenosis patient because they're like, your nerves are getting pinched, cauda equina syndrome, and do you have any bowel and bladder problems? You know, they're very concerned about all that stuff. But the reality is that very few of them actually get to that point where they need, it's a medical emergency. They won't be showing up in physical therapy if they're having bowel and bladder problems. I mean, you still got to ask just to make sure, because maybe they're starting to get it. But if it's like massive stenosis, they're probably going to be in the hospital and having a surgery right away. So don't be afraid to get your hands on those patients and move their spines. Get them to free up and loosen up. Move their soft tissue around their spines. Get all those paraspinals loosened up. It's going to help them out. This study is proof of that. I hope this helps you out, guys. If you have any questions or comments, please drop the comments here. You can direct message me as well. I'm happy to help if you have any questions about maneuvers, manipulations, techniques that I use on my stenosis patients that we see here in the clinic. I can tell you from experience, I move them all. I get those joints moving. I haven't done these techniques they talk about, but I'm accomplishing the same directions of force that they're doing, and I can tell that I get an increased mobility in the spine. And of course the patients all are feeling phenomenal afterwards, and we followed up with strengthening. You have to do your exercise. It's just part of the whole process. But manual therapy allows you to free up some very specific joints in specific directions that can have a huge impact on a spine problem. Anyways, I hope you have a great Monday. Bye-bye.